Hyperthyroidism: the best treatment options. Hyperthyroidism is a condition in which there is an excessive amount of thyroid hormones. Thyroid hormones regulate the metabolism of the cells. Normally, the rate of thyroid hormone production is controlled by the brain at the pituitary gland. There are many possible causes of hyperthyroidism. Common symptoms of hyperthyroidism include restlessness, tremors, weight loss despite an increased appetite, sweating, rapid heart rate, intolerance to heat, and frequent bowel movements. Treatments for hyperthyroidism include medications, ablation, and surgery. Hyperthyroidism is a condition in which an overactive thyroid gland is producing an excessive amount of thyroid hormones that circulate in the blood. Thyrotoxicosis is a toxic condition that is caused by an excessive thyroid hormones from any cause. Thyrotoxicosis can be caused by an excessive intake of thyroid hormone or by overproduction of thyroid hormones by the thyroid gland. Because both physicians and patients often use these words interchangeably, we will take some liberty by using the term hyperthyroidism throughout this article. Thyroid hormones. Thyroid hormones stimulate the metabolism of cells. They are produced by the thyroid gland. The thyroid gland is located in the lower part of the neck, below the Adam's apple. The gland wraps around the windpipe and has a shape that is similar to a butterfly formed by two wings and attached by a middle part. The thyroid gland removes iodine from the blood and uses it to produce thyroid hormones. The two most important thyroid hormones are thyroxine, T4, and triiodothyronine, T3, representing 99.9% and 0.1% of thyroid hormones respectively. The hormone with the most biological activity is actually T3. Once released from the thyroid gland into the blood, a large amount of T4 is converted to T3, the more active hormone that affects the metabolism of cells. Thyroid hormone regulation: the chain of command. The thyroid itself is regulated by another gland located in the brain, called the pituitary. In turn, the pituitary is regulated in part by thyroid hormone that is circulating in the blood and in part by another gland called the hypothalamus, also a part of the brain. The hypothalamus releases a hormone called thyrotropin-releasing hormone, TRH, which sends a signal to the pituitary to release thyroid-stimulating hormone, TSH. In turn, TSH sends a signal to the thyroid to release thyroid hormones. If overactivity of any of these three glands occurs, an excessive amount of thyroid hormones can be produced, thereby resulting in hyperthyroidism. The rate of thyroid hormone production is controlled by the pituitary gland. If there is an insufficient amount of thyroid hormone circulating in the body to allow for normal functioning, the release of TSH is increased by the pituitary in an attempt to stimulate the thyroid to produce more thyroid hormone. In contrast, when there is an excessive amount of circulating thyroid hormone, the release of TSH is reduced as the pituitary attempts to decrease the production of thyroid hormone. Causes hyperthyroidism. Some common causes of hyperthyroidism include Graves' disease, functioning adenoma and toxic multinodular goiter, excessive intake of thyroid hormones, abnormal secretion of TSH, thyroiditis, excessive iodine intake. Graves' disease. Graves' disease, which is caused by a generalized overactivity of the thyroid gland, is the most common cause of hyperthyroidism. In this condition, the thyroid gland usually is renegade, which means it has lost the ability to respond to the normal control by the pituitary gland via TSH. Graves' disease is hereditary and is up to 5 times more common among women than men. Graves' disease is thought to be an autoimmune disease, and antibodies that are characteristic of the illness may be found in the blood. These antibodies include thyroid-stimulating immunoglobulin, thyroid peroxidase antibodies, and TSH receptor antibodies. The triggers for Graves' disease include stress, smoking, radiation to the neck, medications, and infectious organisms such as viruses. Graves' disease can be diagnosed by a standard, nuclear medicine thyroid scan which shows diffusely increased uptake of a radioactively labeled iodine. In addition, a blood test may reveal elevated TSI levels. Symptoms of hyperthyroidism. Hyperthyroidism is suggested by several signs and symptoms, however, patients with mild disease usually experience no symptoms. In patients older than 70 years, the typical signs and symptoms also may be absent. In general, the symptoms become more obvious as the degree of hyperthyroidism increases. The symptoms usually are related to an increase in the metabolic rate of the body. Common symptoms include excessive sweating, heat intolerance, increased bowel movements, tremor, nervousness, agitation, rapid heart rate, weight loss, fatigue, decreased concentration, irregular and scant menstrual flow. In older patients, irregular heart rhythms and heart failure can occur. In its most severe form, untreated hyperthyroidism may result in thyroid storm, a condition involving high blood pressure, fever, and heart failure. Mental changes, such as confusion and delirium, also may occur. Hyperthyroidism diagnosed. Hyperthyroidism can be suspected in patients with tremors, excessive sweating, smooth velvety skin, fine hair, a rapid heart rate, and an enlarged thyroid gland. Hyperthyroidism treated. The options for treating hyperthyroidism include treating the symptoms, antithyroid drugs, radioactive iodine, surgery treating symptoms. Treating the symptoms. There are medications available to immediately treat the symptoms caused by excessive thyroid hormones, such as a rapid heart rate. One of the main classes of drugs used to treat these symptoms is the beta blockers. These medications counteract the effect of thyroid hormone to increase metabolism, but they do not alter the levels of thyroid hormones in the blood. A doctor determines which patients to treat based on a number of variables including the underlying cause of hyperthyroidism, the age of the patient, the size of the thyroid gland, and the presence of coexisting medical illnesses. Surgery. Surgery to partially remove the thyroid gland was once a common form of treatment for hyperthyroidism. The goal is to remove the thyroid tissue that was producing the excessive thyroid hormone. However, if too much tissue is removed, an inadequate production of thyroid hormone, hypothyroidism, may result. In this case, thyroid replacement therapy is begun. The major complication of surgery is disruption of the surrounding tissue, including the nerves supplying the vocal cords and the 4 tiny glands in the neck that regulate calcium levels in the body. Accidental removal of these glands may result in low calcium levels and require calcium replacement therapy. With the introduction of radioactive iodine therapy and antithyroid drugs, surgery for hyperthyroidism is not as common as it used to be. Surgery is appropriate for pregnant patients and children who have major adverse reactions to antithyroid medications. Patients with very large thyroid glands and in those who have symptoms stemming from compression of tissues adjacent to the thyroid, such as difficulty swallowing, hoarseness, and shortness of breath.